An executive order to protect vaccine access in Minnesota, despite new federal restrictions put in place by the Trump administration. Tonight, we're digging deeper into the state mandate announced today from Governor Tim Walz. In a news release announcing the executive order, Walz is quoted as saying, while the Trump administration attempts to limit Americans' access to preventative care, Minnesota will be guided by science and medical expertise, prioritizing the health and safety of our people, end quote. Now, the governor also calling vaccines one of the greatest public health achievements in modern medicine. The executive order seeks to safeguard vaccine availability in Minnesota and give healthcare providers more flexibility when it comes to administering the COVID-19 booster shot, which, under the lead of Health and Human Services Secretary Robert F. Kennedy Jr., is now restricted to people 65 and older, or 6 months or older, who have at least one high-risk health condition. As directed by Walz, the Minnesota Department of Health has issued a standing order for the COVID vaccine, expanding access, removing barriers to access, and providing clear guidance to providers, insurers, and the public on vaccine safety, effectiveness, and availability. DFL State Senator Liz Bolden of Rochester, who is also a registered nurse, responded to the governor's announcement today, saying in part, quote, "Minnesota is taking a clear stand to keep our people safe. This executive order will empower and protect healthcare providers who continue to deliver safe, effective vaccines without unnecessary barriers," end quote. KTDC also reached out to Republican State Senator Carla Nelson, also of Rochester, for her stance on this topic. She was not available to respond tonight by news time. Back in the spring, a bill was introduced by a group of GOP House members that would designate certain vaccines as, quote, weapons of mass destruction. Among the bill's authors, Representative Pam Altendorf of Red Wing. The proposed state legislation would prohibit the possession or distribution of mRNA products in Minnesota. Messenger RNA treatments include several COVID-19 vaccines. The bill, which did not get out of committee, would make administering the vaccinations a crime and punishable by prison time. The governor's announcement today also mentioned pharmacists in Minnesota can give COVID-19 vaccines along with the flu shot to patients ages 3 and up without a separate prescription. That is not the case in all states.